Hi, my name is Brenda Marks, Clinical Educator for Surface Medical. In our new podcast series, we've engaged healthcare experts to discuss the importance of clean and intact soft surfaces for infection prevention. In our first episode, it is my pleasure to introduce Cathy Montgomery. Cathy is an RN and the president and managing partner of Excellentia Advisory Group based in St. Louis, Missouri. Thank you for joining us, Cathy.
Oh, you're welcome.
First of all, can you tell us a little bit about yourself?
Well, sure. I've been a registered nurse for over 30 years, and with the last 17 of those in various capacities within the outpatient surgery space, and specifically in ambulatory surgical centers. So about 6 years ago, in 2009, we started Excellentia Advisory Group as a consulting service specifically for ambulatory surgery centers and office-based surgery centers. Our focus falls in the areas of operations, your day-to-day business, infection prevention, and regulatory compliance. Because you see, all surgery centers are licensed, and even those that provide the most stellar of patient care, they could find themselves in jeopardy if they don't follow the federal and state regulations. We do a lot of training, some by webinar. We do a lot of on-site visits, and we also have infection prevention conferences that we usually do on an annual basis.
So you are definitely a busy lady.
Yes.
In your experience, Cathy, how often do you encounter damaged soft surfaces?
Well, to be honest, I'd have to say probably about 50% of the time. And I do that when I do mock surveys or am in a center to help them if they've had a survey that didn't go well. So I'm actually on site looking at their mattresses, looking at their arm boards. And again, I'd have to say that it honestly falls in the range of about 50%.
Wow. Are there any risks of leaving the soft surfaces damaged?
Well, it's a twofold process. One, because of regulations, obviously. CMS, their conditions of participation require that surgery centers keep a functional and sanitary environment. And when they have a survey, they could be cited for that and potentially have licensure issues. But more importantly, from a patient perspective, it's an awkward situation. They see these patients very often for the first time. They're referred to them by their surgeons, so they've never met them before. And they're reliant upon what their surgeons are telling them, what they find in the H&P, and then what they interview to discover if this patient has any communicable diseases. But if you think about a mattress pad with a tear in it, and you have a patient that, unknown to you, has a communicable disease, and you let them lay on that, even if it's covered with a sheet, they get up, you clean that mattress, here comes the next patient. That next patient is still at risk because that mattress could not officially be cleaned because of that tear.
So given the frequency and the potential risks of this damage, how have you seen your clients deal with this problem?
Most often it's with surgical tape that peels back and really doesn't do its job. You're still harboring microorganisms around that tape, and so therefore, again, it can't properly be cleaned. The other option for the center is to buy a new mattress pad or mattress pads, which that gets pretty costly over time. And then the other thing I guess I've seen is them just take that mattress pad out of service so that they're down a bay potentially, and that's not a good solution either.
Thank you, Cathy. It's been a pleasure speaking with you. If you have any questions for Cathy or like further information on a mattress inspection and repair program, please email us at these email addresses.